Welcome, everyone. Today, we're diving deep into a medical mystery that is often painful, surprisingly complex, and can sometimes turn deadly. We're talking about pancreatitis. We're going to peel back the layers on what causes it, how it can become life-threatening, and why it's such a tough diagnostic puzzle for doctors to solve.
So, let me start with a question for you. What do gallstones and scorpion venom have in common? I know, it sounds like the setup for a really bad joke, right? But the answer is actually the central clue in our investigation today. They can both, believe it or not, cause pancreatitis. Now, a scorpion bite from Trinidad might make for a great medical school exam question, but in the real world, the culprits are way more common.
The reality is, for all the exotic possibilities out there, the story of pancreatitis usually comes down to two prime suspects: gallstones and alcohol. I mean, look at this. Together, they account for a whopping 80% of all cases. That other 20%? Well, that's where you find everything else, from medications and trauma to, even that scorpion venom.
All right, so here's our game plan for this investigation. First, we'll identify the core problem, what it means to have an inflamed pancreas. Then we'll look at the acute attack. After that, we'll see what happens when things turn severe. Then we'll pivot to the chronic condition, and finally, wrap up with the really tricky diagnostic dilemma it creates.
Okay, first things first. We need to understand our crime scene, so to speak. The pancreas isn't just some random organ. It's like a critical factory for our body. But in pancreatitis, that factory goes completely haywire.
So, what is pancreatitis really? At its heart, it's an inflammation of the pancreas. Now, this organ's day job is to produce these really powerful digestive enzymes that break down food in your gut. But in pancreatitis, something goes wrong, and those enzymes get activated inside the pancreas itself. And that's when the organ essentially starts to digest itself. Yeah, you heard that right. That's where all the inflammation and that intense pain comes from.
So let's move on to our first major line of inquiry, the acute attack. This is when pancreatitis hits suddenly, out of the blue. And when a patient comes in with this, there is one absolutely critical question that doctors need to answer right away.
And that question is there any tissue death? You see, in milder cases, the pancreas gets inflamed and swollen, but the tissue is still alive. But in severe cases, that inflammation is so intense that it actually kills off parts of the organ. This is a process called pancreatic necrosis, and it is the single most important factor that determines how a patient is going to do.
And really, it's as straightforward as this. The amount of dead tissue, that necrosis, directly predicts how sick a person is going to get. More necrosis equals a much more dangerous situation. It's the key piece of evidence that tells doctors if they're dealing with a manageable problem or a full-blown, life-threatening crisis.
So now, let's focus on those severe cases where necrosis is on the scene. This is where the investigation gets really intense, because severe pancreatitis plays out on a very specific and very high-stakes timeline.
You can think of a severe attack like a two-act drama. For the first couple of weeks, the body throws everything it has at the problem, a massive inflammatory response. It's a huge storm inside the body, but it's sterile, meaning there's no infection. Yet, the real danger kicks in around weeks 3 and 4. After that initial all-out assault, the body's defenses are just worn down, and the risk of bacteria invading that dead pancreatic tissue goes through the roof.
And this is exactly why that timeline is so critical, because once that dead tissue gets infected, the situation becomes catastrophic. The mortality rate just skyrockets to a staggering 50 to 70%. Let that sink in for a second. This is the moment a critical case can turn fatal.
And the danger? Well, it doesn't even stop there. All that inflammation and dead tissue can set off a domino effect of other terrible complications. We're talking about blood clots in major veins, unstable balloon-like arteries called pseudoaneurysms, and abscesses. And each of these is its own medical emergency.
Okay, let's shift gears a bit. We've been talking about the sudden fire of an acute attack. Now we're going to turn our attention to the slow, smoldering burn of chronic pancreatitis. And it is absolutely vital to understand this. This is not just a long-lasting version of the same problem. It's a whole different beast.
In fact, clinicians think of these as two separate diseases. Most people who have an acute attack, they recover and they don't go on to develop chronic disease. Chronic pancreatitis, on the other hand, is this irreversible, long-term process of inflammation that leads to permanent scarring of the gland. That scarring is called fibrosis.
So how do doctors even track a slow-burning condition like this? Well, they have to become detectives, looking for clues on imaging scans. Early on, the signs might be really subtle, just small changes in how the gland looks on an MRI.
But as time goes on, the evidence becomes much clearer. The gland itself actually starts to shrink, cysts can form, and eventually doctors can see calcifications and stones forming right inside the pancreatic ducts, a surefire sign of serious long-term damage.
And this brings us to the final, and maybe the most difficult part of our whole investigation. You see, after years and years of this smoldering inflammation and scarring, the evidence can get really hard to read, and it creates a diagnostic dilemma where the stakes couldn't be higher.
So here's the problem, and it's a huge one. Sometimes, all that chronic inflammation can form a mass, a lump, in the pancreas. The issue is, on an imaging scan, this lump of scar tissue can look almost identical to one of the deadliest cancers there is, pancreatic cancer. And telling those two apart is the single biggest challenge for doctors in this field.
What makes this even scarier is that the two conditions are actually linked. All those years of irreversible damage from chronic pancreatitis, it actually doubles a person's risk of developing pancreatic cancer. So the very process that makes the cancer hard to spot is also making it more likely to show up in the first place.
Which leaves us with this one final, incredibly challenging question. After decades of smoldering inflammation have left the pancreas completely scarred and damaged, how do you spot a new, deadly fire, a cancer, growing within those ashes? It's a question that really just highlights the incredible complexity of medicine and that constant, critical search for clearer answers.